welcome at Station 1. Hi, I'm Dana. I'm going to be your student nurse today. Can you verify your name and date of birth for me? Alright, thank you. I'm going to check your armband. Do you have any allergies? Alright, I'm just going to shut the door. I'm going to ensure privacy. I'm going to wash my hands. Alright, today I'm going to be giving you an injection. So I'm going to go over all the injection sites for you so you know exactly what I'll be doing. First, I'm going to start with your subcutaneous injection sites. First, you're going to have your abdomen, and then you're going to have your vastus lateralis on your upper thigh, and then you're going to have your lateral arm, your upper back, and your upper hips. Alright? Now we're going to go on to the intermuscular injection sites. First, we're going to find your acromion. We're going to go 3 fingers down, and then inject it right here into your deltoid muscle. We're then going to move on to find the ventrogluteal, and I'm going to find her iliac crest, and then the top of her iliac crest, and then I'm going to find the greater trochanter of her femur, and then I'm going to make a V in between and inject right in between the V. And then I'm going to go around to the back and find again the iliac crest and the greater trochanter, and I'm going to this time inject towards the gluteus muscle to do the dorsal gluteal injection. And then I'm going to go to her vastus lateralis. Once again, I'm going to find the greater trochanter of her femur, and then I'm going to find her patella. I'm going to go about halfway through and go laterally and inject her right into the muscle right there. Alright, now that I've gone over all the sites, I'm going to wash my hands, apply my gloves. I'm now going to review my MAR. It says that I have normal saline 0.5 milliliters subcutaneous. So since it's a sub-Q injection, I'm going to use a 25 to 27 inch gauge syringe, and I'm going to use a 1/2 to 5/8 needle. Alright, and I'm also using an ampule, so get that ready. I'm going to apply a filtered. Well, I wouldn't use this one anymore, but we're going to say I got a new one since it broke sterility. And I'm going to apply the filter to the syringe. Alright. I'm going to open up the alcohol pad. I'm going to stick it around the ampule and break the top towards me. Okay, I'm going to break the top towards me. Alright, now I'm going to discard this in the sharps container. Alright, now I'm going to draw back 0.5 from the solution. Got a little bit more so I can make sure I get all the air bubbles out. Alright, I have 0.5, 1/2. Alright, now I'm going to recap my needle. Okay. Now I'm going to remove this needle, the filtered needle, and add a new one to give to the patient. I'm going to loosen up the cap and get the patient ready. I'm now going to take another alcohol swab and wipe it on their left abdomen. Now that that's dried, I'm going to remove the cap, squeeze up the skin, and go in at a 45-degree angle and inject the solution. Now I'm going to pull it out fast, get the alcohol swab and apply pressure, make sure it's not bleeding. I'm now going to recap my needle, and I'm going to bandage that if it's still bleeding. I'm going to throw away my needle and my ampule in the sharps container, and now I'm going to remove my gloves, wash my hands, then I'm going to step out of the room, and I'm going to document in my MAR
section, and that I gave it in the left abdomen.